Welcome to AHVC Heart Channel, a podcast that explores the wonders of the human heart. I'm your host, Joseph. Today in this episode, we have Dr. Edgar here with us to share about aortic valve stenosis, and we are very excited to learn more from you. Welcome, Dr. Edgar.
Thank you, Joseph. I'm a cardiologist at the Asian Heart and Vascular Center. My name is Dr. Edgar. My interest is really in the human heart and especially with aortic valves. So today we're going to focus a little bit about aortic valve stenosis, which is a very serious heart condition.
Dr. Edgar, we know that heart valves play an essential role to direct the flow of blood around the heart. It's incredible that the heart valve opens and closes about 40 million times per year. Therefore, during a lifetime, they close and open over 3 billion times. These valves seems like they can wear and tear. And what happens when the valve degenerates?
Okay, so all of us are very blessed to have a valve that actually works perfectly when we're born. So in 1512, Leonardo da Vinci actually drew a picture of how these valves actually work, and it's very perfect. The flow is one directional, there is no turbulence, so the whole system is perfect when you're born. But these structures are really like gates, like doors. So if you have a situation where a door is opening and closing, you can imagine what happened to the hinges, and this wear and tear process, just like any door, will deteriorate. So what actually happens is the soft leaflets of this valve will be filled with calcium and harden over time. So that actually makes blood flow through this door more difficult. So it becomes difficult for this door to open. And that's really when the patient will start having symptoms and start suffering from the condition.
I've heard that aortic stenosis is very serious, and it's clear that this has been an issue even several hundred years ago. Who are the patients at risk of developing these conditions?
So aortic stenosis, like we mentioned, really is this wear and tear situation, and most times they require some time before these valves get damaged. The most common time that people develop this symptom starts off usually at the 5th decade, so 50 years old and above. And as each year passes, then that risk increases. There will be some younger patients who develop at a younger age. For example, those with what we call bicuspid aortic valve. They have 2 leaflets instead of 3 leaflets of this valve. And in this particular case, the wear and tear rate is faster. So they could actually present with this condition even 10 years earlier than those usual patients. But in general, 50 years onwards, it will be the kind of patients that will develop this condition.
I know a person with aortic valve stenosis who had whooshing heart sound or murmur. Is that the most common way that patient comes to see you?
Yes, this is actually a very important kind of sign. And in medical school, most of the doctors will be taught how to listen to this sound using the traditional stethoscope. In fact, this has been described as a sound similar to a seagull's cry. So like a squeaky sound, some people call it a whooshing sound. So why this happens is because when these valves are narrow, just imagine you are doing a whistle, you create a turbulent. Once you have turbulence, what then happens is, of course, this produces a sound. So we call this in medical school a murmur or a sound. But actually, the most accurate way to diagnose aortic valve stenosis actually is using something called an echocardiogram. It's an ultrasound-based test, and this basically requires us to just put some gel, use a simple machine that just scans the heart, and within about 10 to 15 minutes, you have the diagnosis, and you have a very accurate assessment of the patient's heart valve condition. Now there's also other tests that we can do, including things like CT scan to look at the valve, to look at the calcium deposits on this valve. We have to look at the patient as a whole. If the patient has a valve that is very narrow, then the patient will have symptoms of shortness of breath, they may look tired, they might look fatigued, and all these, when you put together, you can then make a correct and accurate diagnosis of aortic stenosis.
Data suggests that survival is reduced to 50% in 2 years if patient is not adequately treated. Is this true? This sounds very serious.
Yeah, so this is something that we always reinforce or re-emphasize to people, that aortic stenosis, if it's severe and causing patient symptoms, right, it is probably more serious than some kind of cancer. So it's indeed true that if we do not treat these patients, then they have what we call a sudden event rate or even sudden death rate of about 50% over a course of 2 years. So that is very, very serious. Why this is so is actually quite easy to understand. So you imagine the valve is a door, right? So if this door does not open, no matter how hard this heart pumps, you cannot get blood to flow out of the heart. And that results in all the organs not receiving enough blood flow. And also when a patient becomes, say, unwell, or say the patient falls down because there's not enough blood flow, one of the ways that people treat these patients are what we call CPR, right? And CPR is trying to push blood out of the heart. But if you imagine there's a door that is locking the outflow of blood, then you really cannot resuscitate or save these patients quick enough. So that's why the mortality or the survival rates are quite poor. So it's very important, especially when we talk to patients, especially older patients. There's a lot of times when these patients come in, they would be told that, oh, you are breathless, you're tired, you're fatigued, really because you're old. But that cannot be the case because you know of many active elderly patients who are also very well. They don't have symptoms. So you cannot attribute some of these symptoms just to aging because some of the aortic stenosis symptoms are very subtle. Not everybody will get severe chest pain and dramatic kind of presentation. Sometimes it's just fatigue, feeling tired and all that. So it's very important to emphasize, I think, to the audience, especially to older folks, that if they have symptoms, especially symptoms associated with exertion, and if the symptoms don't go away and affects their quality of life, then certainly I think it warrants some kind of evaluation by their family doctor, by their cardiologist, and then really to assess whether they have this condition or not. So this is a very, very important point.
I can imagine that the fear of treatment might drive some of these decisions. What are the treatment available? I'm sure many of these has been fine-tuned over time. Now, many are talking about the new TAVI treatment that does not require surgery. Can you share more about this?
We always say that some medications can treat certain conditions, but in some cases medications cannot. And aortic stenosis is one condition where medications cannot, because this is really what we call a structural problem. There's a mechanical obstruction, and the only way to treat this valve is a mechanical solution. So if you cannot, say, give a medicine that soften the valve or make the calcium go away to open the valve more, so you can't do that. So in this case, the only way you can treat this blockage is to replace the valve. So you'll be quite surprised that actually this whole field of treating this valve actually only started in 1960, where heart-lung machine was invented and the surgeons were able to then do valve replacement. But in those earlier years, up to today, it's still traditional open heart surgery, which means open the chest, look at the valve, cut away the valve and sew in a new valve. So that's very traditional, very effective. But many patients are always fearful because if you say, I'm going to open up the chest, half the patients will be very, very worried. So about 2002, one very, I would say, adventurous cardiologist actually decided to do an experiment whether he could deliver a stent. You know, we have stents that we put for people with heart artery blockages, but those are small stents. He decided to say, why don't we build a bigger stent and we try to stent this aortic valve, just like how we open up blockages in arteries. So he got his engineers to sew in some leaflets that look like the human valve, put it on a stent, made the stent really small, and then pushed the stent through the legs, and then delivered this stent into the heart. And that was the first time in 2002 the first patient was treated. And then that came to be what we call TAVI, or transcatheter aortic valve implantation. So that really started the whole field. And almost now is 2002 to today, almost 20 years. The systems, the treatment process, how we select patients, all those things have improved so much that nowadays, in order to treat this patient, you don't really need surgery anymore. It's basically a procedure that is done under local anesthesia. Patient is just slightly sedated. And again, because the procedure is quite easy to do through the leg, patients don't need any major cuts and they can actually go home very quickly. Versus surgery in the past where you had to open the chest, and now the treatment is a lot more palatable, more acceptable by the patients. So nowadays, if you tell the patients that a TAVI is possible, most of them will be agreeable to undertake treatment. Whereas in the past, when you tell the patient, oh, you have to open up your chest, we have a study several years ago, you ask the patients, about 40% of patients don't want to have their chest open. So it's still a very Asian mindset. Surgery is always a taboo, or people are just generally scared of it. So now with this treatment, I think it's changed the whole field, and people are generally more accepting that this is less invasive, more acceptable treatment for many patients. So I would say this is a big win for cardiology and for patients.
Many people listening would now understand how the heart valve works, especially aortic stenosis and its treatment. How would you want them to take home today?
I think the most important message is that everyone who feels fatigued or short of breath should not put off their symptoms, especially if the symptoms persist. This is especially important if you have older friends and family who may attribute this to aging alone. So in those situations, please encourage them to visit their doctor, family doctor, or cardiologist. From our talk today, you know that now aortic stenosis is very easy to diagnose with a simple ultrasound scan. And there is now very, what we call, less invasive options for treatment that is actually quite palatable and acceptable to many patients. So I think this is probably the most important point I have for you.
Thanks for joining us and listening to this episode of AHVC Heart Channel. And thanks to Dr. Edgar for sharing insights on aortic valve stenosis. Next time, we will be talking on another important heart condition. Do stay tuned for the next episode. Thank you, Dr. Edgar.